Hi, this is Utah Family Voices. We are a family-to-family health information center. We are umbrellaed under the Utah Parent Center, and together we offer information and resources statewide to families of kids with special health care needs and disabilities. So this is a recorded webinar to inform families of the process of Division of Services for People with Disabilities. My name is Christine Evans, and I am a mom to 4 beautiful kids. I've worked for Utah Family Voices for about 10 years, and my kids all have some varying degrees of disabilities or special health care needs.
Hi, I'm Jody Hansen, and I have 2 boys. My oldest has high-functioning autism, and my youngest has cystic fibrosis and cerebral palsy.
If you would like to print out your application or view it along with the webinar, it can be found on the Dspd website at www.dspd.utah.gov/eligibility. Scroll down to the application that's titled Intellectual Disabilities and Related Conditions. So we're going to start with what is a waiver. Medicaid waivers help provide services to people with disabilities who would otherwise be in a nursing home, hospital, or a long-term care facility. It waives the parent's income and is based on the individual's income and assets, no matter the age. Home and community-based waivers, also known as HCBSW, are listed here. The acquired brain injury waiver, which is managed by Dspd, is for those who have an acquired brain injury and are over the age of 18. The Community Supports Waiver for people with intellectual disabilities and related conditions is also managed under Dspd with an onset of the disability under the age of 18. The Physical Disabilities Waiver, also managed by Dspd, is for those individuals over the age of 18 who can otherwise self-direct their care. The Medically Complex Children's Waiver is one of our newest waivers in Utah, and it is for those under the age of 19, and it is managed by the Department of Health. It is for kids who have 3 or more specialists they see outside of their pediatrician's office. The Travis C waiver is a technology-dependent waiver that is managed also by the Department of Health, and it is for those under the age of 19. The New Choices waiver and the aging waiver are both managed by Department of Health and is for our elderly population who want to be in a different setting other than a nursing home. The next slide is what is Dspd. The Division of Services for People with Disabilities promotes opportunities and provides supports for people with disabilities to lead self-determined lives by overseeing home and community-based services for more than 5,000 people who have disabilities. Some support includes community living, day services, supported employment services, and much, much more.
Okay, so who is eligible for a community supports waiver, or the CSW? A person has to have a substantial, and that's a big word in this, a significant functional limitation in 3 or more of the following areas. Are they deficit in being able to do their self-care, to bathe themselves, to get dressed, to do things for themselves? Are they able to understand their wants and needs in a way that people understand them with expressive language, or able to understand what's being said to them? Do they have any kind of learning disability? If they do, then they may be eligible. Mobility, are they able to walk and provide their mobility, their physical needs? Do they understand self-direction? Do they have the capability of living independently? And if they're 18 or over, are they able to be self-sufficient in their economical needs? If they have any of these that they have difficulty with and that it's significant, they may be eligible for the CSW. Okay, what can be provided by the CSW? Behavior consultations, chore services, companion services, day supports, financial management services, non-medical transportation. You may be able to get Medicaid and residential help. Respite is huge for families. They also can help with supportive employment and supported living, and any kind of supports that's deemed necessary between the family and the support coordinator. You may want to choose to have some behavior consultations done. You may want to look at tour services. That might be that they come in and help keep their apartments clean, or laundry, or their rooms. Companion services, day supports. That is a program that might be set up for the person in their own individual needs with the team. Financial management services, do they need help with their bills or help with their finances? If they do self-direct care, it could be with a fiscal agent. That might be their financial management services. Somebody who will help take care of paying your employee if you hire them to come into the home. Non-medical transportation, Medicaid, residential, if they're unable to stay in the home, then it can help pay for them to live in a home that might meet their needs better. Respite is time for the caregivers to have time to do self-care or to do things that are difficult, like grocery shopping, which seems to be a hard one for all of us, maybe working or doing other things. Supported employment, if they're needing help with getting a job and needing some supports while they're in that environment. Supported living, this is when they sometimes will take a person out into the community. They have a couple of goals that they have to look at as what they're doing in the community, and any other supports that might be deemed necessary. Then you will sit down with your support coordinator and discuss the different areas that you're needing help with. So how do I apply for a community supports waiver or Dspd services? You can call 1-844-275-3773 to speak with an intake worker, and they will send you an application for you to fill out. Or you can go to dspd.utah.gov/eligibility, and you can print out the application. You'll go down to the bottom and it will say intellectual and community-based waiver application. This application is also available in Spanish. So everything that you're going to be doing is based on the person with the special needs. So all of this information will have their information. So the Form 1-1 will be in this packet, and we're going to go over how to do that. The social history is also in this packet, and the release of information is in this packet. So you are going to want to have a copy of the individual's social security card, their birth certificate, copy of their Medicaid card if they have one, and if they have social security income, that you'll want all of that information. You also will need to have a psychological evaluation done on the individual that's been done in the last 5 years. And if you're unable to acquire that, then you can talk to the intake worker and see if there are any available resources for you. You also will need to have medical records relevant to this disability. However, if you don't have your medical records, it's okay. You don't need to go speak to all of the individuals. Dspd will do that with the release of information. Okay, Form 1-1. So this is simple, right? I mean, we sometimes get really nervous about how long this is going to take, but this is just basic information. You are filling this out for the person with the disability. You see, we've got that highlighted there. So this first part is for the individual. So it's just their name and their phone number. You can put your phone number in there if you need, their date of birth, their gender, their social security number, and their address. If they don't have an email, that is just fine. If they can sign it, then you will have them sign under applicant signature. If they're unable to, they can do a dot, they can do an X, or they don't have to sign it. And then the parent or guardian needs to sign it. And then you'll put your contact information on that next line and your relationship. The next is the social history, and there are 4 pages of this. Again, you're filling this out for the person with special needs. So again, their information is that first part. Their physical address. If they have a different mailing address, you can put that. Otherwise, you can just put NA or same. And their telephone number and email if they have that. If they don't, just leave it blank. The next 3 are for contact persons. You would put your name in that first box and your information. And then you need to let them know if you are their legal or court appointed legal guardian. This is mostly for those who are over the age of 18 and have had guardianship. Everyone needs to put it if you are the legal guardian, but that's kind of what they're looking for. And if you have guardianship papers, also if you need a translator. And this application is also done in Spanish. The next page, the next 2 are contacts. If there's somebody else that might be a person, maybe a spouse or their mother, father, guardian. The next one could be somebody not living with you that they're able to get a hold of if you move and the information hasn't been updated, then they can get that. Then the name of school, that's the last name of the school that you last attended. Just the type of school. Is it elementary, high school? Is it early intervention? Is it post-high? And then they'll want to know if the person had early intervention services. Also, if they had special education services. And if so, are they still in school? Then when will they transition out? If they're over the age of 16, you'll need to put their history of employment. If they're not, you can just put NA. The next part is if they, again, on the top there, it does have some more information about employment, if they've had voc rehab. And then you have things for letting them know a little bit more about your child. So behavioral would be what types of behaviors might be relevant to your child or your loved one. Is it that they won't leave the house? Is it that they hit? Is it that they scream? You know, what different behaviors are they doing that make it difficult for you to care for them, or that they just really struggle with? Mental health would be more the diagnosis or the things that are happening that are not behavioral. So if they have some diagnosis, anxiety, OCD, any type of mental health issue. And then medical health related services, are there certain things that they continually on a regular basis are needing to see doctors for certain types of medical health? Do they have substance abuse, and how does that affect them? That's what you put in that line. Safety, are they runners? Do they try and get out of the house? Do they climb on everything that, you know, would make it difficult for them, that they could fall? Anything that they do that might be unsafe. Do they hurt others or themselves? The next one is if they have a brain injury, then you would put that there. And then, do they use any kind of medical or specialized equipment? Do they have a G-tube? Do they have a wheelchair? Do they use a walker? Any of those types of things of durable medical equipment. Have they been in the hospital in the last year? If so, you would want to put that in the next spot, and when they were treated and what day they were released. Has the person been in a nursing facility or in an intermediate care facility? Are they now? Have they ever been? When they were there, and the discharge date, if that is applicable. The next part is for agencies that might be involved with your family. If you don't know what these are, then you're probably not involved in that agency, and so you can just either put NA or leave it blank. Division of Child and Family Services, Adult Protective Services, Office of Public Guardian, Veterans Affairs, Juvenile Justice Services, County Aging Services, or Mental Health Services. If you have any of those, you're going to want to put their contact information and how to get a hold of that person. Then you want to put any applicants for your professional relationships, such as doctors, school representatives, therapists, anything that you might need. And you can add another paper with some of this information if you have more. Are there any court orders with the person, the individual? Do they have any kind of benefits? Are they getting Social Security, income, retirement, any kind of earned income? Then you're going to want to put that here. All of these services are based on the individual's income and assets, not based on the parent's income or assets. Does the applicant have Medicaid or Medicare benefits? And you're going to want to put who the social history was completed by and the date. So this is the good news. The next paper it will be filled out by the intake worker. You don't have to do anything on that one. Yay! The next part you can fill out beforehand, or you can wait till the intake worker comes in. So this is section 3. Again, you can wait for them to do this if you want to wait to make sure that you understand how to fill that out. So you don't need to turn this in at this time. And then the next paper is the authorization to furnish information and release liability. So this is the paper that they would send to any doctors, therapists, psychological evaluations. And so you'll put the person with special needs again. Remember, this is for the individual. And then you will put the school district that you would want information. If there's more than one school district involved, you would put the last school district, because all of your information, educational information, will be sent to the latest school district. If you have anything in the Division of Rehabilitation, any kind of mental health centers that may have been involved, physicians or psychologists. The next part asks what you're willing to give the information. If you're unsure and you feel comfortable with them getting all information from anybody, you can just mark each of those. And then you need to tell them when you're willing to have them get that information. If you're willing, again, for all information from birth, then you can put birth to the present. And then on the next section, you'll want to mark that to establish eligibility for Dspd services and the expiration date. You may want to put something like 5 or 10 years from now if you are concerned about them continuing to get information. You always can ask to have this removed, that you don't want them to have access to this information. And then you just fill out the bottom part. And guess what? That is all of the paperwork that you have to have. The rest of the information that is behind this is for you to get information about Dspd and what services you can use while you wait.
Thanks, Jody. So what happens next? After you send in your application, as outlined on the application through fax, email, or handing it in directly to the Dspd office, Dspd should be contacting you for further information within at least 2 weeks. If you have not heard from them, please give them a call and see if they have received your application. You will want to also make all copies of the application and write down the date that you sent it in, so you'll have that date when to contact them. If you are found ineligible, you have the right to appeal that decision by filling out the appeal form that is on their website. You can refer back to the indicators of eligibility if you have questions at any time about eligibility of the individual. Dspd is going to be rolling out a new needs assessment for those individuals that are on the wait list. So changes are coming. Please pay attention to what is on the website regarding that. It will be July 1st of 2019 when new needs assessment will be in effect. All right, so what do I do while I wait? Utah Family Voice and the Utah Parent Center have the Family to Family Network, which is a great resource for families while we're waiting on the wait list. The Utah Parent Center also and Utah Family Voices, combined with the Family to Family Network, offer meetings and workshops. Attend those meetings, support the networks. You'll not only learn about more things that are going on in our community, but we'll also be able to learn how to advocate for our families. Put on your running shoes. We are going to need you, and we are going to need to help each other. Sometimes by being more involved with the networks and with Utah Family Voices and Utah Parent Center, we can come together and learn about those things that can help us receive these services. Working closely with the people we know often gets them to think of your family when things or opportunities come up. These services do take effort, even when you are off the wait list. Unfortunately, you can have all the money in the world and still not be able to find your tribe. So this is what we can do while we're waiting. Let's find our tribe. Also, pay attention to what is happening during the legislative session. Look at what bills are coming up and what your representatives are supporting. Look for things that are going to help and support your family. And always thank the governor, thank your legislative representatives for things that they are supporting that will make a difference for your family. Also, while you're waiting, you'll want to update your waitlist worker as often as you can, at least yearly or as often as your situation changes. If there are health changes to the individual or health changes to the caregivers, let them know what is going on. If your child or your young adult are having a bad day, always update your waitlist worker if it's something that is a little bit more unusual that's been happening. So again, our names are Christine Evans and Jody Hansen. You can reach us here at our office at 801-272-1068. Or this is Jody's direct email. It's JodyH, JODIH, @utahfamilyvoices.org. And we're happy to help you answer any questions or find additional resources within your community.